Welcome back. As we continue today's coverage of SNN Good Health Day, we take you to the emergency room, of course, one of the busiest areas of any hospital. We're joined by SNN anchor Mia McCormick. She's there live at the emergency room, and she can tell us more about the importance of that ER and, of course, saving lives.
That's right, Lena. I'm standing in a place where no one wants to be, but probably once, maybe twice in your lifetime, you're going to find yourself here in the emergency room. And here at Doctors Hospital, they actually have an advanced primary stroke center and an accredited chest pain center here. So just two ways that they can really help patients that come into this emergency room. And earlier today, Grant Boxleitner actually got to take a tour of the whole center here. Let's go ahead and show you that.
The ER at Doctors Hospital is a state-of-the-art unit, fully capable of treating anyone who ends up here. Dr. Fred Romano is the medical director for the emergency department.
People come for three main reasons. They're scared, they're in pain, or they're actually just sick. So my job is to determine which one of the three you are and then address that exact need. I think one of the things you have to be able to do is keep your head on a swivel and turn and be able to shift your focus when it needs to be there.
One section is called the Fast Track area. Doctors Hospital Director of Emergency Services Mary Lee Arnold explains.
It's where we usually try to steer our patients that we can move in and out quickly. So somebody that comes in with back pain, that maybe just needs a couple of x-rays, somebody that doesn't require full workup.
And the interesting thing about the ER is in any given day, you don't know who's going to wind up in here.
Absolutely.
It could be one person, it could be a dozen.
Absolutely. I like to joke that it's predictably unpredictable. You never know what's going to come next, but you know that it's always going to be that way.
We now head into room 6, reserved for the most critical patients.
A wide variety of things in here. So usually in this room, if somebody's having a heart attack, if somebody's stopped breathing or if their heart stopped working, this is the room we steer them to. So we have what we call the crash cart in here. So we've got our defibrillator, we've got all of our medications that we give to people that are struggling for life.
Typically a lot of accident, traffic crash victims could end up here. In what other types of scenarios?
They could, absolutely.
Massive heart attack.
Massive heart attack, stroke, somebody that's having a massive allergic reaction.
And there's a new pediatrics cart that makes caring for younger patients more efficient.
If you know that you have a child that falls into the green zone, all you do is pull out the green door, you've got everything there for you.
So if you do wind up in one of these rooms, Romano says the medical personnel here are trained on the latest techniques needed to save a life.
They can expect an edge to it that provides each person with a little bit of education as to what we're doing, why we're doing it, so that it's not such a fearful situation.
Reporting at Doctors Hospital, Grant Boxleitner, SNN Local News 6.
All right, now I know Grant talked a little bit about that pediatric dosing system. It's called the Broslow system, correct?
That's correct.
Can you tell me how it works?
Sure. Well, we actually have two components of the Broslow system. We actually have a Broslow cart, which is divided up by the weight of the child. So if we know that a child falls into a red category, all we have to do is open the red drawer and everything is sized appropriately for that child. We also have a computer program called eBroslow, and we can enter the weight in the computer and it tells us exactly what dose for every single medication. It tells us how to dispense meds for home and all kinds of things. So it's really almost error-proof when we're dealing with children, which is what we hope for.
I can see how that would be really helpful, especially sometimes patients are hard to gauge, and it's not a one-size-fits-all type of thing, right?
Absolutely not. Children especially, they're not just small adults. We really want to make sure we're doing the right thing for them, treating them individually.
All right, Mary Lee, thank you very much. Again, we are live inside the ER here at Doctors Hospital, and coming up in the next half hour, we're going to take a look inside the emergency vehicles. Lena?
We look forward to that, of course, as we continue our SNN Good Health Day, together saving lives.